I consider a mental disorder or mental illness to be a condition that affects feelings or emotions, thoughts, or the thinking process, including concentration, the ability to remember, as well as behavior, including often social behavior. So in the case of mental illness, emotional and or mental complaints deserve the individual or lead to personal suffering. And significant mental disorders may also lead to behavioral and personality changes, and as a result of such mental disorders, social integration may be impossible. As I began practicing Chinese medicine, more patients, or perhaps most patients, expressed emotional and mental complaints as accompanying symptoms to physical disorders. And in the last decade, frustrations, sadness, anger, forgetfulness, poor concentration, etc. are often primary motivations for patients for seeking support with Chinese medicine. Understanding emotional and mental complaints has always been a priority in my clinical practice. Learning about the patient's emotional experience often has important clinical relevance, and asking about emotional experience during the questioning procedure for all complaints confirms for the patient that I, as a clinician, am interested in them as well. So, in addition, most patients describe some psychic symptoms. Now, even though the main complaint of the patient may be physical, there is sometimes an emphasis on the psychic complaint in addition. And in terms of a primary complaint, I would probably say roughly up to 40% of the patients I see today complain as a primary complaint of a mental, emotional, or psychic condition. The treatment approach is based on a clear diagnosis, and it's very important for me, therefore, to understand the specific mental and or emotional complaints as part of a pattern. So I look at 4 basic causes of mental emotional conditions, generalizing. When we look at all the possible causes, I simplify down to 4, and then I consider sub-patterns. For example, stagnation is a main cause of mental emotional disease, especially for qi and blood stagnation as key pathologies. And I look to identify key symptoms and signs of that pattern so that I can quickly understand the sub-pattern, eventually understanding also what organ systems are involved, and maybe make a formal Zhang Fu diagnosis in order to more precisely treat with my prescription. But the advantage of understanding the sub-pattern, getting a clear picture of that sub-pattern, is that it allows me to move very quickly into a treatment strategy, for example, stagnation, dispersing stagnation, and lead me to combination of individual herbal medicinals, which can help support the patient's main goal. There are 3 other key patterns, one being a restless Shen pattern, which is related to heat, another cause being deficiency, for example, deficiency of blood, deficiency of yin, and this leads to a sub-pattern, what I refer to as a weakened Shen. And the 4th pattern is a pattern involving loss of consciousness. It's, of course, not a pattern we see every day in the clinical situation, but this 4th sub-pattern separates all other mental emotional conditions and explains a pattern of unconsciousness or different degrees of altered consciousness, and that's a condition which I refer to as clouding of the mind, referring to phlegm as the main pathology. So again, in summary, I try to simplify the diagnosis. From a clear, simple diagnosis of a sub-pattern, I can begin looking at the appropriate treatment possibilities. I have been very happy with the results of Chinese herbal medicine in the treatment of mental disorders or in supporting patients with mental emotional conditions. Although I have prescribed in raw herbal formula forms and was also successful and happy with the results there, I have had many years of experience using herbal concentrates. And in the last 10 years, I've been very fortunate to have the experience to use tinctures or fluid form herbal formulas and modifications from them, and I've seen and noticed that I can expect a very reliable effect from these tinctures, as well as I've noticed, of course, that the patient compliance is very high because they're a very acceptable form of taking herbal medicine. I'll start with a general statement that I always look to make a relatively quick change in clinical symptoms and signs, recognizing, of course, in some very chronic condition that there is some time that's required. But I'll look for a practical or operational goal, establishing a prognosis with the patient of about a month to see some positive change. And sometimes it's a change in the intensity of the complaint, sometimes a change in how often it occurs or the frequency of the complaint, and sometimes it's a change in how long that symptom remains present, if that's relevant to the topic. So in general, I try to look for a quick change, some positive signs to help the patient understands there is hope in some case where it looked hopeless, and in other case that there's a quicker relief. In addition, of course, we have to consider not just the chronicity of condition, but also the pattern itself. Some patterns, some sub-patterns are easier to affect than some other patterns, and so we can expect differences. And to finish up on this idea that the results will affect the pattern, I'll mention that a chronic deficiency, especially of a significance leading to a weakened Shen, as I referred to that sub-pattern, that takes some time. So one might expect a period of building up in addition to addressing specific symptoms. So although I'm looking for a quick effect and trying to support that with the herbal therapy, I'm also anticipating with some patterns that it may take more time. So one other aspect I'd like to mention is that there's always additional features to look at. Some perpetuating factors for the mental emotional condition have to be discussed with the patient. If, for example, it's a sleep disorder, then one needs to introduce the topic of sleep hygiene or support the fact that they should develop a regular sleeping pattern. And in other cases, looking to talk or understand how lifestyle factors, inappropriate, may affect the mental emotional condition as well. That has to be also discussed. So the first point is with the herbal therapy, looking for a positive change in short period of time, and also, of course, recognizing that there's more than just the herbal medicines affecting the condition and trying to support a pattern change. I would again repeat that I've had very much luck. I've been very happy with the effect of herbal therapy as a support therapy for mental emotional conditions. I am particularly happy when patients, after the treatment has been resolved, after there's been a closure of the treatment where the symptoms have been relieved, report back that they, without herbal therapy, after a course, remain very satisfied with the results, often remaining symptom-free or approaching certain conditions which may have been triggers, such as stressful conditions, differently. So the very positive response to from patients through the herbal support has shown me that Chinese herbal medicine offers a very significant therapy for such conditions.